Management Associates.
Welcome back, everybody, to Wellness Wednesday on New Day. When you suffer from chronic pain, many things in life are put on hold, but the doctors at Northwest Pain Management are treating their patients in ways that can change that. Returning to the show from Northwest Pain Management, Dr. Geoffrey Tyson and his patient, Mary Dougherty. It's great to see you both again, and I'm so glad you're feeling better. That's really great. Dr. Tyson, just remind us of Mary's diagnosis and her previous experience.
Sure. Well, when we were on last year, Mary had been a patient of mine for about 10 years at that point and had come in with a history of several years of chronic pain. We kind of advanced through a number of treatments for her, including medication management and some targeted spinal procedures that gave her some temporary relief but really didn't solve her problem. So about a year ago, we finally decided to proceed with spinal cord stimulation trial on her. We did a temporary system implant, which gave her very good relief, and then just about a year ago, she had her permanent implant.
All right, we're going to explain what that all means in a moment. But Mary, first, take us back to life before this implant.
I don't really think you could call it much of a life. It was very painful every day. I didn't do much of anything except try and go to work and come home and sleep. That pretty much described my everyday.
Where did you hurt, and do you know what caused it?
At first, I hurt in my neck. I had a neck injury at work. We had that fixed, and then it just radiated at different times at different parts of my body, and then it just got to the point where it was from head to toe, and it hurt to walk, it hurt to put my shoes on, it hurt to do anything.
Which is incredibly depressing.
Yes, it is. And there's only so much medication you can take to make it better.
And even when you do, you're sleepy or otherwise out of it, so you're you know, trading one thing for another.
Right.
Dr. Tyson, explain the spinal cord stimulation that we use, we meaning you, used on Mary.
Well, the spinal cord stimulation systems are basically systems we have where we can put a small set of electrodes that look like this into the epidural space and interrupt pain transmission actually at the spinal cord level.
Okay.
And what we do is we put a temporary system in, and if the patients have good temporary relief from that, then we have a permanent system placed. The permanent system.
This gizmo?
That's the permanent system implant, and the advances we've had in the last a little more than a year now are these new devices that allow us to actually hook up 4 of these sets of electrodes, so we can actually cover pain in all 4 quadrants of the body, essentially from the base of the skull to the toes. And that's the system that Mary has.
That's what she has. And Mary, what's the difference in the way you feel? How soon did this work?
Almost immediately. I had literally no pain except for the incisions immediately. And now I can turn it on and turn it off as needed. I can move the stimulation around. Boston Scientific is very helpful in setting up programs for me, and if I have any questions or need it tweaked a little bit, I just call them up and they meet with me.
That is incredible. I mean, like a miracle.
Oh, yes.
We want to take a look at you last year because it'll help draw the contrast. So here's a clip.
Surgical incision areas where they have to make small incisions in the skin to implant the permanent devices.
What a relief.
Oh, absolutely. I was ecstatic. I was up the next day walking around.
And you took one look at my shoes and said, you're waiting to get in heels here pretty soon. So I want you to do that too. Are there technological advances? Hey. The reason we wanted to play that for you is because she is in heels. She's in fact in some rockin' hot heels right now. And I just want to give you a chance to get up and walk around so people can see what a different, I mean, not that this is the only thing you wait for, but look at that.
I waited for a long time for this.
Absolutely.
Thank you.
And, you know, I hope you don't mind my mentioning, but obviously you've lost a good deal of weight as well.
Yes.
Because you are active.
Yeah.
And so overall,
amongst other things.
Amongst other things.
Yeah, yeah.
How would you describe it, if you can, in words, the difference between prior to the temporary stimulation to now knowing this is a part of your life forever?
First of all, I go to work every day, or most every day, bosses, except today. I have scheduled my very first trip to Italy and through the Greek Isles, which was a dream because I could never have done it before this. And it's basically what they say, the world is my oyster.
Exactly.
I can go and do whatever I want right now.
And that's what we all, want, is something to look forward to and those possibilities in the future. And when you have chronic pain, that can often just go away.
Absolutely.
She's been obviously a success case. What are the success rates of this procedure in general?
Well, at least in our practice, of the patients that we do the temporary system implants on, with the new Boston Scientific system now, we're over 90% of those patients going on to permanent systems. And I'd say about 90% of the patients who get permanent systems get about the same level of relief they get during the temporary system implant. So for the patients who are candidates for this, these devices can be absolute miracles.
That is wonderful. Thank you very much for telling us about it. Mary, I'm so happy for you.
Thank you.
Good to see you strutting around in those boots, girl. Right after the break, our Wellness Wednesday continues with ways Community Health Plan is speeding up the diagnosis and treatment of mental health issues for their members. That's next. Our Wellness Wednesday guests are back to answer some of your questions today. Please welcome back Dr. Geoffrey Tyson from Northwest Pain Management, Dr. Bob Nabalski from Northwest Hair Restoration, and Joshua Showers from Community Health Plan of Washington. Welcome back to all of you. Dr. Tyson, we had a question come in about basically who is a candidate for the spinal cord stimulation, what kinds of illnesses or injuries, and what might they have been through by the time they get to you?
Sure. Well, the three FDA-approved indications for this are failed back surgery syndrome, which is where patients have had spine surgery and continue to have pain problems after that. So that's probably the most common reason we see these devices used. The two other ones that we see are diabetic peripheral neuropathy, where patients have pain from diabetes, and a condition called complex regional pain syndrome, where you've got a patient who's got some nerve injury and has a persistent pain problem that develops after that specific injury.
And these people have been through a lot before they get to you,
yes,
get to this option.
The average patient we see has been in pain for more than 5 years and seen somewhere between 5 and 10 other physicians before they come to us. And they've pretty much exhausted more conservative therapies. We would want to make sure patients have had attempts at medication management, things like physical therapy, acupuncture, that type of thing. And particularly in Mary's case, we did some targeted spinal injection therapies to try to really find the source of pain and treat the specific cause. When that fails, or when somebody has a more generalized pain problem like Mary, they may be a candidate for this type of device.
Very good.